Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Good afternoon, everybody. We have gotten lots of questions lately about COVID and kids and the vaccine in kids and COVID in newborns and how to manage visitors and how to ask about vaccine status and all of the things. So I asked Dr. Rebekah to join me. You can introduce yourself briefly, tell us who you are and why we're going to have this talk.
Perfect. Very excited. I'm Rebekah Diamond, aka Parent Like a Pediatrician. I'm a hospital pediatrician in New York City. I'm the mom to a toddler, dealing with all the same struggles you all are dealing with, and also trying to help you when I'm not in the hospital navigate all of the crazy info out there and get the best info possible. So yes,
Love it. I'm so grateful for your account and your content in this day and age. And I think we complement each other really well because our focus is pregnancy and breastfeeding, and you take from the breastfeeding through to the young kids. And so many people have so many questions right now. The first question, I think it's very, very easy for both you and I to answer, was, do you have any concerns about vaccinating your child when the vaccine is officially approved for kids their age?
I assume you said no because I'm about to say no. I'm real excited.
No. Not excited. Me neither. No concerns. These vaccines and the technology is so amazing and so safe. And I think half the world's population has been vaccinated, correct? Something like that.
It's billions of people. Billions.
We know the vaccine is safe. When I look at the vaccine technology, if you guys want to understand the technology, I did a podcast with Happy Farm Life, Sienna, and back in February, and we talk all about the ingredients in the vaccine and how it works, and you should be really reassured. I would vaccinate my kids today if I could get hands on a dose, regardless of the approval.
Yeah, I'm sure. Yes. Just pure excitement, no hesitation.
Exactly. Same here. Okay. Then I thought what we could do is walk through. So a lot of people ask us, what are the risks of COVID in newborns and younger children under 5? Are we more worried about the Delta variant? What kind of symptoms are we seeing, et cetera, et cetera? So I'm wondering if you could speak to that a little bit.
Yeah, I'm really fortunate because I'm in a relatively highly vaccinated area with good mask adherence. So we haven't seen that same Delta spike in kids the way you're seeing in some other states in the United States and also in other countries. But it doesn't mean that I don't take it seriously. So I love giving you like very convoluted theoretical answers, but I'm going to do it. So everyone, strap in. I had to do this. Because I think it's important to take a step back and look at the big picture. You're getting two things told to you. I think some version of one or two things. The first is COVID is super scary and it's the only scary thing that exists, and everyone's going to have something horrible happen if they go near COVID.
Yeah.
And the second is COVID's no big deal, especially for kids, and why we're talking about it. And were that anything were like that and so simple, but the reality is it's not. COVID remains a disease that tends not to affect children with the same intensity, especially with acute illness.
Mhm.
And we're grateful for that. I think that's wonderful. So the percentages of children who are getting critically ill with Delta or even who are having long COVID is less than it is for adults. And it's still less than it might be for a lot of other things that we worry about in pediatrics. But it's not zero. And it definitely seems to be a little bit more with Delta. It's not quite clear if it's related to how we test these days, how we recognize it, and just the fact that there's so many more kids who are getting it. So again, a small percentage of a large number is a very large number. So if it's a 1% chance of getting very sick, 1% of millions of children is probably millions of children. And that's what we're seeing in the intensive care units in those states that are really not taking the basic measures they need to do to protect children from COVID, as well as a variety of other things. So Yes, Delta is affecting kids more, most likely primarily as a function of the fact that so many more kids are getting it because it's untransmissible at this point. But also, there's good reason to think that it's a little bit more of a what we call a virulent disease, meaning a little more disease. Again, nothing that you need to panic about. It just is one of the many reasons why protecting kids from COVID makes sense. There's the acute illness, there's the loss of school, there's the ongoing pandemic, there's long COVID. The list goes on. So try not to get too caught up in the is COVID bad for kids, yes or no. COVID's bad for kids. Pandemics are bad for kids.
Totally.
They're bad for kids. The question is, how do we use the information about its transmission, its virulence, its effects on kids to make policies? That's like a different conversation. But for you, what I want you to know is you're right to want kids not to get COVID and do your best to protect them. And that's going to include masks for now and vaccines. And that's basically it.
Totally. Yeah. It's so interesting. I feel the same way. Like from what we've seen, kids aren't getting really sick. But what I always tell people is that statistics are great when you're talking about the population, but when you're the individual, you could be the 1%. So we have to do the things. We have to encourage people to get vaccinated because we know the safety is there. We have to continue to ask. And for me right now, I don't want my kids to get COVID just because I don't want them to get sick, but it's like mostly it's in the pain in the behind for me and my husband to try and get childcare sorted while we're working, right?
Yeah, you always need to weigh risks and benefits, but try not to get caught up in the narrative of weighing COVID risks against random irrelevant risks. We really should only weigh the risks of COVID to kids against the risks of the measures that we take to prevent COVID in kids.
Yeah.
So if we were saying shut down all schools forever, which the American Academy of Pediatrics strongly said no, and actually they said masks so that schools would stay open, then I would say, no, guys, like we have to tolerate some kids getting COVID, kids need school. Just like your favorite analogy is seatbelts. We're not saying don't drive a car. People need to drive cars, but that would prevent all car accidents and that would save a lot of lives. We're saying wear a seatbelt. Are there risks of seatbelts? There actually are. And this is not a seatbelt discussion right now, but there are, and there are a lot of moves against it. Yet again, those risks pale in comparison to the benefits and the risks of masks for now and vaccines for everyone just don't exist on the same level as the risks of COVID. And that's just a fact.
And I think this really segues nicely into we get a lot of questions around, oh my gosh, I have a newborn at home and my kids going back to school or visitors and safety. And I think you've hinted at this, but it's so important to balance the risks of exposure versus the risks of like your mental health. If you're not sending your kid to school, the child's mental health, your mental health, if you're not having visitors come into the home to help with a newborn, there are risks of both sides. And we have to be safe, but we have to live our lives.
Right. You can mitigate risk, but you can't eliminate it. And you certainly can't eliminate it without introducing new risks that might very quickly outweigh the benefits of that. So I agree completely. Infants, newborns, they're higher risk of getting sick from anything, including COVID. The groups, for those interested in a little bit of the science, the groups that seem to be more affected by acute COVID seem to be the little kids, little babies, who just are more fragile in general. And then the teenagers who are having a physiology that behaves a little bit more like the young adults. So all to say that that's a little bit of a higher risk group, but again, you need to be able to have a life that lets you parent your children and lets everyone be healthy.
Exactly. Exactly. So I'm going to share my sort of general advice I give to people postpartum, and I would love to see your thoughts if you agree or if you have any other suggestions. So typically I say I would recommend like I would not allow visitors into my home if they're not vaccinated, double vaccinated. I would be very selective about who comes into my home to visit and help with the baby. But I think it's totally appropriate to have people come and help and visit, whether that be your parents, whether that be a doula, whether that be a few select friends that you trust that are vaccinated and that are also doing the measures, wearing their masks, washing their hands. If someone is not vaccinated, I say, if they really need to see your baby, do it outside more than 6 feet apart, and that it's okay to ask people if they're vaccinated. That's generally the advice I give, and I would love to hear your thoughts and anything else you might want to share.
That's really the crux of it. And the funny thing, right? Not funny, but the thing is, I've been following this advice, giving this advice before COVID even existed.
Yeah.
So we talk a lot about when it's safe to have visitors or take your newborn out. And it's really the same principles. You're trying to protect them, especially with visitors, from exposure to infectious disease and all the potential things that could happen with that. COVID's just one of the many viruses, but many things that could, affect a newborn. And then that will cause other stresses, possibly like having a fever, going to the hospital, having breathing problems. Again, we can't live in fear and have no exposures, but we can certainly be a little more restrictive in those first few months, especially. Um, and yeah, I've been asking for proof of vaccination before it was even cool. I can't even tell you. It was like I would talk anyone who's coming over. I was like, yeah, so your Tdap's up today, and they'd be like, what? And they're like, figure it out. I'm not to tell you. You want to touch my child? She doesn't have her pertussis syndrome yet. I have my pertussis antibodies flowing to her, but not worth it. Go to CVS. It's free. Enjoy. Flu shot, same thing. MMR was on today. All of them, and I was very lucky that I wasn't in a family or a social circle where that was a problem. But if anyone gave even a little bit of, oh, do I really have to do this? I'd be like, listen, it's my daughter. It's my daughter's life. You love her. I love her. Yep. It's at worst an inconvenience and she deserves it. And it was super non-negotiable to me. Again, I speak from a place of not having to have serious family fallout from it. So I know that's really tough. But again, one thing I found, I've talked to a lot of people about this too, a lot of great psychologists. If it's really sorry, I'm getting checked by comment. Vaccines, the politicization of vaccines. Yes, it's so crazy. They're just a health measure. And what I've noticed the patterns are, it may seem like this is just about the vaccines, but it usually isn't. Family dynamics are complicated, and this is really just one of many boundaries you're going to be setting as a parent. So it's not like caving on this one thing that's going to repair all sorts of potential conflict. If anything, it usually just becomes about something else. Yeah. Again, I'm not telling you how much of a strong stance to take with this. That's going to be up to you, but I fully give you permission to do so.
Yeah, I couldn't agree more. And I think that as a parent, you have to make a lot of really difficult decisions, but you have to make the decision that's right for you and your child and your immediate family and hold that boundary. And it's okay to ask people if they're vaccinated. It's okay to tell people if they're not vaccinated, they can't come to your home. And how they choose to interpret that is their problem, not yours. It doesn't make it easy, but
no, I've done it. And the situations have been sometimes uncomfortable. Again, it was just with people at the playground or people my daughter was starting to become friendly with. And I just was like, oh yeah, we're all vaccinated. Or, oh, I'm so excited that I'm going to, be eligible for a booster, or when are her vaccines coming around? And every once in a while, someone would be like, oh, we're not ready. And they'd be like, oh, it was lovely to meet you. It's not worth it. The risk benefit, it was just not worth it in those cases.
Yes. No, exactly. Like my oldest went over to a friend's for play date, and before he went over, I just said, I just want to make sure you guys are both vaccinated. And she said, oh, of course. And I said, okay, great. He'll be right over. Yep. It's very easy to do. And I don't think you have to sugarcoat it. You can just directly ask. And I don't think it's an unreasonable thing. And most people are probably expecting these days.
Yeah. Some stop phrases are helpful, especially for text. I had someone who started saying, we worked through it, and they said, to protect my unvaccinated child, we're only hanging out with people who have the vaccine. Thank you for understanding, kind of thing. And then totally, vaccinated, or they'll say, I don't want to hang out.
Beautiful. I love it. Yeah. Do you have any other good phrases or recommendations for people who are uncomfortable asking?
Just ask, or just say, normalize it. Again, if you would rather shoot it off as a text. I'm a big fan of face-to-face, so I might just say, oh yeah, we can't wait to see you, to protect this unvaccinated bundle of joy, whatever her name is. We're only having vaccinated visitors. Hope to be able to see you soon. Something like that.
Yeah. Beautiful.
It's not on you. It's on them. Remember, the argument that everyone has a right to choose, which legally, ethically, morally is a valid argument, whether they have a vaccine, that's an argument, but it doesn't mean you get to choose and then still do all the things you want to do. Mm-hmm. And I have to be able similarly to choose that I only want to hang out with people who are vaccinated. And that's just my choice too.
Absolutely. I thought this is a good way to segue into a lot of the questions we get around the vaccine approval sort of timeline in terms of children. I think it's age 5 to 11. And then if you have any insight into, I have no idea because I don't have the time to read around it. Kids under 5, if there's any sort of research going on or any timeline for that population.
Yeah, I do. I have great news. Lots of my information is very United States focused. So if you're in a different country, I don't have quite as much info for you. Hopefully it'll follow a similar pattern to whatever it followed for adults following the US. So I think you can probably extrapolate a little bit. But Pfizer submitted data for 5 to 11 to the FDA, and they're going to seek EUA approval probably this coming week. And then they'll meet shortly after that. So everyone keeps saying by Halloween, it's 5 to 11 will be able to have the vaccine. I think that's an ambitious but very doable thing. And then hopefully next month, we'll do the same for the 2 to 11 age group with approval shortly after that.
That's amazing.
Hoping. I'm really hoping. I'd love to see by this calendar year, almost all kids be eligible. I think the morals, ethics, science, all the realities of it point to this being the right thing to do.
Yeah.
Again, it's really easy to see the risks of something. It's really not as easy to see the risks of not doing something. And so all these theoretical, tiny, whatever, real to consider, but eventually, essentially very small risks, they're going to pale in comparison with the risks of ongoing transmission infections, COVID. Kids are really suffering. And it's one of these things like if viruses didn't mutate, it would be a little easier to say, okay, let's just shut it down for a few months, do the things we got to do, and then take it back down. But it doesn't work that way. People's behavior impacts a virus. A virus impacts, other. It's so dynamic, and the mutations and the resistance, it means that every day matters in terms of handling this. And kids just really need to get back to normal as soon as possible.
I couldn't agree more. I think that we're on a similar timeline in Canada. I can speak to that for the 5 to 11 group, but I'm not sure about the 2 to 11. But that would make me so happy because my youngest is not yet 5. I really want him to be vaccinated.
I know. I have no pause. I have no doubts. And I can parse through any specific concerns. I bet you got some questions on them too, or you may have. But I certainly get questions about, are you worried about the theoretical hyperimmune response or the idea that they might have MIS-C, which is that inflammatory condition that was or the myocarditis that was happening very rarely. It's the older teens, young adults. And the answer to, am I worried about them is no. Do I think about them? Yes. And the reason I can say that they're real and I think about them and I'd like to, consider it in my decision making is because that's how science works. Everything has a benefit and risk profile. You have to weigh against each other. But the risks of COVID are super real. And that's what you're comparing this against. I see COVID myocarditis all the time. I see MIS-C all the time. It's from COVID. It's from the disease that kids are basically all going to get, because that's where we are at this point, if you don't get vaccinated. And we know that vaccines prevent not only immediate disease and death and hospitalization, they prevent long-term effects. We've seen this with countless other vaccines. And so the myocarditis that we were seeing with teens, it was temporary, it was not fatal, it was exceedingly rare, and it's something that we're able to manage and deal with appropriately and decide how we're going to give what doses to kids based on it. Versus the myocarditis from COVID, I have seen young adults die from this. I can't, and I'm not saying that to make people feel bad or scared. I'm just letting you know it's like a pretty simple equation. If you say this is the vaccine with the information we have, the information we had a year ago, basically too, but especially the information we have now versus this is COVID, which is only going to get worse in so many ways. I'm not even going to, it's okay not to make it as complicated as people want it to be. It's okay to just decide and trust that these vaccines are working and that kids deserve them. And like I'm seeing in the comments, kids really tolerated the vaccines. The doses are a little less so that they don't have the same immune response. And that's based on some theoretical and some laboratory things. And it seems like the response is just as good with the lower doses in terms of efficacy. So there's all the things are being thought of. They really are. And I just want this vaccine so bad. I want my patients to have it. I want my daughter to have it. If someone is saying they are concerned, that's okay. It's okay to have questions. It's okay to talk through all the things you're seeing. But if someone just doesn't want it, doesn't trust it, thinks it's evil, can't be reasoned with in any way, I don't know. It's usually because they've succumbed to or are spreading some sort of for-profit, for-gain misinformation.
Yeah.
And I just don't see why we have to tolerate that and our kids just don't deserve.
I know. Actually, after this live, I know I'm going to share the podcast that you recorded with Alicia. It's so well done. It's talking about sort of vaccine hesitancy in parents and common concerns that people have, and you address them so beautifully and so compassionately. I encourage everybody to listen. I even encourage people who are hesitant themselves to get the vaccine to listen to that podcast, because all of the concerns that people list, it's not just specific to children, specific to anyone who's hesitant about a vaccine. It really makes you understand like some of the industry and the misinformation behind this.
Yeah.
Yeah.
It's an industry. And again, I don't want to discourage skepticism. I've loved being a skeptical consumer. I love being skeptical of like pharma and medicine, but
Yeah.
it's not like all this other counter information is necessarily coming for some sort of good place. It's usually even more nefarious than anything I could have imagined in my medical training. And at the end of the day, why let people profit off of it when it's just hurting your kids? I have nothing but compassion for parents, and I have nothing but anger at these other people who are really manipulating that. Yeah, I see a question in here about a 5-month-old in vaccine. So there's no information yet until 6 months and older. Isn't any data that we expect. So when your kid turns 6 months, which is soon, then once the approval happens for 6 months and older, definitely expect it. I don't think it's going to be submitted at the same time as 2 to 5 or 2 to 4, but I'm not sure. It's changing constantly. The nice thing, and again, if you didn't get the vaccine in pregnancy, that's okay. But if you did, that's really nice protection for your newborn. And then any amount of breastfeeding is a little boost. I feel less like of a rush for the teeny tinies, because that type of testing is a little more complicated. The immune system is very different in those first 6 months. And so we only start certain vaccines then. It requires a lot of testing. So I don't expect that. I agree. I don't expect that many times.
Yeah. And I think, when we look at things like the influenza vaccine, we don't give that until 6 months of age.
Exactly.
But kids do fine, because exactly, most people are pregnant, they get vaccinated, they get that IgG. And then if you're breastfeeding, you get continued ongoing protection. So, yeah.
And herd immunity, it's real.
Yes,
So
it is.
get your bubble vaccinated. That's why you're going to tell those people before they come over, like, my kid can't get the vaccine, my newborn, and she can't get it anytime soon. So either you get it to protect her or you hang out.
Yeah. Totally agree. Totally agree. Oh my gosh. Thank you for this conversation today. I hope it helps, informs, calms some fears, and answers some questions that a lot of people have. And I think probably knew the answer to, but just it's nice to hear it again in a concise format. And I will share the podcast that you guys did. And everyone, if you're not following Dr. Rebekah at Parent Like a Pediatrician, she has amazing, you do so many great posts around answering people's questions to COVID, and you answer them in such a compassionate way. I feel really fortunate to have found you.
The feeling is completely mutual. And please send more questions my way. And just remember, it's okay to trust science. It's okay to trust yourself. It's okay to refuse to go down this rabbit hole of worry, anxiety, profit. It's okay to just be like, enough. This was quite a year.
Yeah.
We got to end it. Let's wrap it up.
Agree. I'm over it.
I'm done.
Good to see you.
So good to talk to you. Thanks so much.
Thank you.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood, and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.